Welcome to Ulosca channel. Access all nursing practice questions. ATI RN Adult Medical Surgical Practice questions with answers.
Question 1. A nurse is assessing a client with heart failure. Which of the following findings indicates fluid volume overload? A. Weight loss. B. Clear lung sounds. C. Neck vein distension. D. Decreased blood pressure. Which one is the correct answer? The correct answer is C. Neck vein distension. Explanation. Neck vein distension occurs when excess fluid increases venous pressure, often seen in clients with heart failure and volume overload. Question 2. A client with pneumonia is receiving oxygen therapy. Which action by the nurse ensures safe oxygen use? A. Place oxygen tank on the bed. B. Use petroleum jelly on lips. C. Keep oxygen at 6 min continuously. D. Post a no smoking sign. Which one is the correct answer? The correct answer is D. Post a no smoking sign. Explanation. Posting a no smoking sign prevents fire hazards around oxygen, which supports patient safety in all care areas. Question 3. A nurse is caring for a client who is post-op following abdominal surgery. Which of the following actions reduces the risk of atelectasis? A. Administering antacids. B. Encouraging use of incentive spirometer. C. Applying antiembolic stockings. D. Increasing opioid analgesics. Which one is the correct answer? The correct answer is B. Use of incentive spirometer. Explanation. Using an incentive spirometer encourages deep breathing and lung expansion, helping prevent atelectasis after surgery. Question 4. A client with a history of hypertension reports dizziness when standing. What is the likely cause? A. Orthostatic hypotension. B. Stroke. C. Hyperglycemia. D. Tachycardia. Which one is the correct answer? The correct answer is A. Orthostatic hypotension. Explanation. Orthostatic hypotension results from a sudden drop in blood pressure upon standing, leading to dizziness or fainting. Question 5. A nurse is caring for a client with chronic kidney disease. Which lab finding is expected? A. Elevated creatinine. B. Decreased potassium. C. Increased calcium. D. Low BUN. Which one is the correct answer? The correct answer is A. Elevated creatinine. Explanation. Creatinine levels rise as kidney function declines because the kidneys can no longer effectively filter waste products from the blood. Question 6. A client with type 2 diabetes has a blood glucose level of 45 milligrams DL. What is the priority nursing action? A. Administer long-acting insulin. B. Encourage exercise. C. Provide orange juice. D. Call the lab for retest. Which one is the correct answer? The correct answer is C. Provide orange juice. Explanation. Providing orange juice is a fast-acting intervention to raise dangerously low glucose and prevent loss of consciousness or seizures. Question 7. A nurse is teaching a client about preventing deep vein thrombosis. Which instruction is appropriate? A. Cross legs when sitting. B. Massage calves regularly. C. Wear compression stockings. D. Limit movement after surgery. Which one is the correct answer? The correct answer is C. Wear compression stockings. Explanation. Compression stockings enhance venous return, reduce stasis, and are a key preventative measure for post-op DVT risk. Question 8. Which finding in a client with COPD requires immediate attention? A. Oxygen saturation of 88%. B. Clubbed fingers. C. Productive cough. D. Respiratory rate of 32. Which one is the correct answer? The correct answer is D. Respiratory rate of 32. Explanation. A respiratory rate of 32 suggests acute respiratory distress or hypoxia and should be addressed promptly to avoid further compromise. Question 9. A client receiving morphine reports itching but denies rash. What should the nurse do? A. Discontinue morphine. B. Administer antihistamine. C. Notify infection control. D. Apply steroid cream. Which one is the correct answer? The correct answer is B. Administer antihistamine. Explanation. Itching from morphine is a known side effect due to histamine release and can usually be treated with an antihistamine without stopping the pain medication. Question 10. A nurse is assessing a client who had a thyroidectomy. Which finding indicates a possible complication? A. Hypoactive bowel sounds. B. Hoarseness. C. Facial twitching. D. Elevated heart rate. Which one is the correct answer? The correct answer is C. Facial twitching. Explanation. Facial twitching may be an early sign of hypocalcemia from accidental damage or removal of the parathyroid glands during surgery.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.